Welcome back to Vital Signpost. As nurses, we're always striving to stay ahead of the curve, and today we're diving deep into a condition that's unfortunately becoming more and more common as our population ages: Parkinson's disease.
Yeah. It's estimated that about 1 million Americans are living with Parkinson's and over 60,000 more are diagnosed every year, and that's just in the U.S.
And it's not just a U.S. issue, it's a global concern with over 10 million people affected worldwide, so
Definitely a topic worth understanding thoroughly.
absolutely. So today we'll unravel the mysteries of this complex neurodegenerative disorder, explore the challenges of diagnosis, and delve into the various treatments, and of course the crucial role that nurses play in caring for these patients.
A good place to start, I think, is with the brain itself.
Right, the brain, the command center for everything we do. And in Parkinson's, a specific region called the basal ganglia is at the heart of the problem.
The basal ganglia, it's like the brain's orchestra conductor, ensuring smooth, coordinated movements. But when it's affected by Parkinson's, the music gets a little off-key.
So what exactly is going on in the basal ganglia when someone has Parkinson's?
Well, picture this. There's a delicate dance happening between two key neurotransmitters, dopamine and acetylcholine. Dopamine's the calming influence, the one that keeps things smooth and controlled.
Like a brake pedal.
Exactly. And acetylcholine is the accelerator providing the energy and drive for movement.
So it's a balancing act.
Yeah, it's a delicate balance, and in Parkinson's, this balance gets thrown off.
Okay, so how does that happen? How does this balance get disrupted?
The culprit is the destruction of brain cells, specifically in an area of the basal ganglia called the substantia nigra.
The substantia nigra, that's where dopamine is produced, right?
Precisely so, as these cells die off, dopamine production decreases, leading to a shortage of the brake pedal, if you will.
And that leaves acetylcholine with too much influence.
Exactly. The accelerator is left unchecked, and that's what leads to the characteristic motor symptoms of Parkinson's, the tremors, the rigidity, the slowness of movement.
And don't forget the postural instability.
Right, the postural instability, the difficulty maintaining balance, those are all classic signs.
The TRAP symptoms: tremors, rigidity, akinesia, and postural instability. It's like a mnemonic to help us remember the hallmarks of Parkinson's.
It's a good one to remember.
It is, but diagnosing Parkinson's isn't always straightforward, is it?
It can be tricky. There's no single test that definitively says, yep, that's Parkinson's.
So it comes down to recognizing those TREP symptoms through careful assessment and ruling out other conditions that might mimic Parkinson's.
Exactly. It's a process of piecing together the clinical picture.
And here's something I found really fascinating while we were prepping for this deep dive. Did you know that symptoms often don't show up until about 80% of those dopamine-producing cells in the substantia nigra are already gone?
That's right. It's a silent progression for quite a while before the outward signs become noticeable.
That's a sobering thought, isn't it?
Definitely it underscores the need for early detection and intervention. Research into biomarkers that could help identify the disease in its earliest stages is crucial.
Absolutely. Now let's talk about what causes this destruction in the first place. What triggers the death of those dopamine-producing cells?
Well, like with many complex conditions, there's no single answer. It's likely a combination of factors.
So genes, environment, lifestyle, all playing a role.
Exactly. There are some gene mutations that have been linked to an increased risk, but the vast majority of Parkinson's cases are what we call sporadic, meaning there's no clear genetic cause.
So even if you don't have a family history of the disease, you could still develop it.
Absolutely. And on the environmental side, exposure to certain pesticides and herbicides has been implicated as a potential risk factor.
And head injuries, especially, repeated trauma to the head like we see in some athletes.
Right. Those can also increase the risk.
I've also read about the role of oxidative stress, the buildup of harmful molecules called free radicals. Could that contribute to the damage in the substantia nigra?
Oxidative stress is definitely a player. It's a natural process that occurs in all our cells, but when it gets out of control, it can cause damage. And the dopamine-producing cells in the substantia nigra seem to be particularly vulnerable.
So it's a complex web of factors that ultimately lead to Parkinson's. But even though there's no cure yet, there are treatments that can help manage the symptoms and improve quality of life.
Absolutely. We've made significant strides in managing Parkinson's, and we'll delve into those treatment options in more detail in the next part of our deep dive.
Now let's shift gears a bit and talk about the crucial role that nurses play in caring for patients with Parkinson's.
Nurses are really at the forefront of providing care and support.
Yeah, we're often the first point of contact, and we spend so much time with these patients, we get to know them really well.
Absolutely. So it's vital that we have a deep understanding of the disease and how it progresses so we can provide the best possible care.
So when we're assessing a patient with Parkinson's, what are some of the key things we should be looking for?
Well, first and foremost, we need to remember that Parkinson's is a progressive disorder, which means that symptoms will worsen over time. So ongoing assessments are key.
Not just a one-time thing.
Exactly. We need to be vigilant in monitoring for changes in those motor symptoms, like the tremors, rigidity, slowness of movement.
But it's not just about the physical symptoms, is it? Parkinson's can affect a patient's mental and emotional well-being too.
Absolutely. We need to be aware of the potential for cognitive changes, mood swings, depression, anxiety. Those are all common in Parkinson's.
So our assessments need to be holistic, taking into account the whole person, not just the disease.
Precisely, we need to be looking for subtle changes in their thinking, their memory, their ability to concentrate.
And their emotional state?
Exactly. Are they withdrawing from social activities? Are they expressing feelings of hopelessness or despair?
It's about picking up on those subtle cues that might indicate a change in their condition.
Right. And sometimes the best assessment tool is simply listening, giving the patient space to share what they're going through.
That human connection is so important.
It really is. Now, let's talk about medication management, which is another critical aspect of Parkinson's care.
We discussed the different drug classes in the previous section, but what are some specific things nurses need to keep in mind when it comes to administering and monitoring these medications?
Well, one of the most important things to remember is that many of these medications have a narrow therapeutic window, meaning the difference between an effective dose and a dose that causes side effects can be very small.
So precision is key. We need to be meticulous about dosages and timing.
Exactly. And because these medications often need to be taken multiple times a day on a strict schedule, patient education is paramount.
We need to make sure patients understand how to take their medications properly and what to do if they miss a dose.
And we need to explain the potential side effects, what to watch out for, and when to contact their doctor.
I imagine medication interactions are also a big concern, especially since patients with Parkinson's often have other health issues and might be taking multiple medications.
You're absolutely right. We need to review their entire medication list, including over-the-counter drugs and supplements, to identify any potential interactions.
And there are also dietary restrictions that come with certain Parkinson's medications.
Yes. For example, patients taking MAO-B inhibitors need to avoid foods high in tyramine, like aged cheeses and cured meats.
Because that can cause a dangerous spike in blood pressure.
Exactly. So providing clear dietary guidelines is essential.
It's all about empowering patients to take an active role in managing their condition.
Absolutely. Now, in addition to medication management, there are also non-pharmacological approaches that can be very beneficial.
Like physical therapy, occupational therapy, speech therapy.
These therapies can help patients maintain their function, improve their quality of life.
Physical therapy can help with strength, flexibility, balance gait.
Occupational therapy focuses on adapting activities of daily living to make them easier to perform, and speech therapy can address problems with swallowing, voice volume, articulation.
It's all about helping patients maintain their independence for as long as possible.
Right. And we can't forget about the emotional and psychosocial aspects of Parkinson's. This disease can really take a toll on patients' mental health and their relationships.
So providing emotional support, connecting them with resources like support groups and counseling services is so important.
Absolutely. Nurses can play a vital role in providing that support, being a listening ear, a compassionate presence.
It's about being that advocate, that cheerleader for our patients, helping them navigate the ups and downs of this challenging disease.
Well said, nurses are truly on the front lines of Parkinson's care, making a difference in the lives of patients every single day.
So we've covered a lot of ground in this deep dive into Parkinson's disease, but before we wrap up, I think it's helpful to really solidify our understanding by putting our knowledge to the test.
Yeah, a little quiz time always helps to reinforce what we've learned.
Right, so we've put together some review questions that touch on key aspects of Parkinson's disease, everything from diagnosis to medication management and nursing interventions.
Ready to put your thinking caps on?
I think so. Let's jump right in. First question, which condition would alert the nurse to a potential caution or contraindication regarding the use of a dopaminergic drug for the treatment of mild Parkinson's disease? Is it A, diarrhea, B, tremors, C, angle closure glaucoma, or D, unstable gait?
All right, so we're thinking about dopaminergic drugs. Those are the ones that boost dopamine levels in the brain, and we need to identify a condition that might make it risky to use these drugs.
Exactly. So which of those options raises a red flag?
The answer here is C. Angle closure glaucoma. Dopaminergic drugs can dilate the pupils, and that can worsen angle closure glaucoma by blocking the flow of fluid in the eye.
Leading to increased pressure and potentially damaging the optic nerve.
Right, so that's definitely a contraindication, or at least a situation where we'd proceed with extreme caution.
Makes sense. All right, let's move on to question number 2. A patient is taking entacapone as part of the therapy for Parkinson's disease. Which intervention by the nurse is most appropriate at this time? Is it A, notify the patient that this drug may cause discoloration of the urine B limit, the patient's intake of tyramine-containing foods? C, monitor the results of renal studies because this drug can seriously affect renal function, or D, force fluids to prevent dehydration.
So in this case, the most appropriate intervention is A, notifying the patient that entacapone can cause discoloration of the urine. It often turns the urine a brownish-orange color.
But it's harmless, right?
Yeah, it's not medically significant, but it can be alarming if the patient isn't expecting it, so it's important to let them know ahead of time.
It's all about setting those expectations and preventing unnecessary worry.
Right, patient education is key.
All right, question number 3. This one has multiple possible answers, so listen carefully. The nurse is reviewing the medication orders for a patient who has been taking Siligilin. Which of these medications, or medication classes, if ordered, would cause a problem because of a drug interaction? Is it A, warfarin B, meperidine C, a cough syrup that contains dextromethorphan D, serotonergic antidepressants, or E, erythromycin?
This one really tests our knowledge of drug interactions, so we need to think about Siligilin. It's an MAO-B inhibitor, and those can interact with a few different medications.
So which of those options would be a no-no if the patient is already taking Siligilin?
The correct answers here are B, C, and D, meperidine, dextromethorphan, and serotonergic antidepressants.
Because combining those with Siligilin could lead to serotonin syndrome.
Exactly, and that's a serious condition that can be life-threatening.
So again, it highlights the importance of medication reconciliation and being aware of potential interactions.
Absolutely, we need to be vigilant.
Okay, question number 4. A patient will be taking Siligilin 5 milligrams daily in addition to dopamine replacement therapy for Parkinson's disease. The nurse will implement which precaution regarding Siligilin is it? A, teach the patient to avoid foods containing tyramine B, monitor for dizziness and orthostatic hypotension. C, inform the patient that this drug may cause urine discoloration, or D, monitor for weight gain.
So we're back to Siligilin, and we need to think about the most important precaution to implement.
What's the biggest concern with this medication?
The answer is B, monitoring for dizziness and orthostatic hypotension. Siligilin can cause a drop in blood pressure when standing up, which can lead to dizziness and increase the risk of falls.
So we need to be proactive in assessing for that and implementing measures to prevent falls.
Right, things like teaching the patient to change positions, slowly making sure they're well hydrated.
Those simple interventions can make a big difference.
Definitely. All right, last question, question number 5. A patient with Parkinson's disease will start taking entacapone along with the carbidopa-levodopa he's been taking for a few years. The nurse recognizes that which of these is an advantage of taking entacapone? Is it A, the entacapone can reduce on-off effects? B, so levodopa may be stopped in a few days? C, there is less gastrointestinal upset with entacapone? Or D, it does not cause the cheese effect? So here we're focusing on the benefits of entacapone when added to carbidopa-levodopa therapy.
What does entacapone bring to the table?
The correct answer is A, entacapone can reduce on-off effects.
Those unpredictable fluctuations in motor symptoms that can be so frustrating for patients.
Right, entacapone helps to prolong the action of levodopa so it can smooth out those fluctuations and provide more consistent symptom control.
Which ultimately improves the patient's quality of life.
Absolutely, and that's always our goal, isn't it?
It is, and that brings us to the end of our review questions. I hope you found them helpful.
Yeah, it's a good way to wrap up our deep dive into Parkinson's disease.
We've explored the complexities of this challenging condition, from the intricate workings of the brain to the crucial role that nurses play in providing compassionate and comprehensive care.
It's been a privilege to share this journey with you.
And we hope you've gained valuable insights that you can apply to your practice.
Remember, knowledge is power. And by staying informed and engaged, we can make a real difference in the lives of our patients.
Absolutely so. Until next time, stay well.